the birth date. Okay, and if the child can't give their name and their birth date, what should the nurse do? You guys know? Ask the parent. Ask the parent. They can do it. Okay, so you have a question here. Press pause if you need a second to do it, and we will come right back and I will go over it with you. So you have an infant. He has tetralogy of Fallot, and he is discharged with a prescription of digoxin. How should the nurse teach the mom to do it? You guys know teaching is very big on NCLEX-RN, so I hope you picked B, administering digoxin with a calibrated dropper. Again, digoxin is one of those medications you have to know what you need to do before you give digoxin. What do you guys need to do before you give it? You need to take a what? A pulse. That's right. What kind of pulse? Come on, guys. You need to take an apical pulse for 1 full minute. Okay? Let's move on. Okay, we are going to get into some age-specific nursing care, and it kind of follows the continuum that we are already on. So first, let's start by just realizing that no matter what a patient's age is, they have certain rights to these few things. The first thing is safety. The second thing is confidentiality. You guys know that's big on NCLEX, not sharing patient information. The third thing is pain management. The fourth thing is control, or they have the ability to say yes or no to treatment. So I wanted you to know that as control. Then we have comfort. Also, involvement of the family members or significant others. So those are the things that patients have the right to, no matter if they're 1 day old or 100 years old. Okay, now our first age group is the ages 1 through 12. The top 2 nursing priorities for this age group, number 1, it is medication errors. It is so easy to mix up pediatric doses for medications. Pediatric patients are actually 3 times more likely to experience a medication error than an adult. The second major nursing priority is going to be complications from an IV. Don't little kids love to pull on things that they're not supposed to touch? You know, if you tell a kid not to touch something, they'll definitely touch it. And we have that problem in nursing. It's so hard for nurses to keep pediatric patients' IVs intact and clean. So that is going to definitely be a concern for you, protecting that IV. Before giving any pediatric patient any medications, what are you going to ask them for? Their name and birth date. And yes, I keep reiterating this because it is so important, and I can say it 100 times, but when you're taking the test and you're so nervous, you'll forget. So I want to keep saying it. Make sure you definitely ask the name and birth date. Also, properly positioning your patient is very important as well during the feeding and giving oral medications in this age group. You're trying to prevent aspiration. And let me just go back to, again, the pediatric patients. You ask them for their name and birth date. If they can't give it to you, it is okay for the parents to say that for you. The biggest fear for this age group is definitely separation from their primary caregiver. Do you know what the biggest fear for adults are? Public speaking. Public speaking. That's not even NCLEX related, but I thought you might like to know that. My Remar tip for this page is that we are remembering that children tend to regress when they are sick. So when I say regression, I mean they will start to exhibit behaviors of a younger child. So somebody who is 7 or 8 years old, when they get sick, they may have some bedwetting accidents, right? So we let parents know that that's going to be normal during the sick times. And they will speed up when they are feeling better. They'll bounce right back. Let's move on to the next page. Page number 10. We have 13 to 18. These are our teenagers, and the goals for this age group is to develop relationships with the opposite sex. That is where their primary focus is going to be. We as nurses have 2 goals. We want to, number 1, help our patients to establish a healthy sexual identity. establish a healthy sexual identity. And then number 2, also help them to cope with the body changes that they will be experiencing during this time. The issues for the females in this age group is going to be menarche, the beginning of menstruation. That is going to be their own priority. And for the males, it's typically acne. Acne, yes. So I threw in here acne medication because I felt like this was the perfect time. And this is how I want you guys to study medications as well. It is much better to put the medications into the system or the disease that you're studying as opposed to just studying a whole list of medication by themselves. That's really difficult. But if you kind of slide it into other things that you're studying, you'll find that you have a very easy time learning this. So right here we have the medication isotretinoin. And this is also called Accutane. And I put both names on here, but NCLEX states that they will not be putting any trade names, only the generic names. But for me, it's much easier to study them both together. And it's practical because when you're working on a hospital, new doctors will very rarely write acetaminophen. What they're going to write is Tylenol. So, study them together unless it's a huge burden for you. But let's talk about Accutane. What you need to know about it is that, number 1, it will elevate the triglycerides in your patient, which triglycerides are fats found in the blood and in food. Okay. Number 2, any woman that's taking this medication needs to be on 2 forms of birth control because this medication will cause severe birth defects. Now, 2 forms of birth control is like being on the birth control pill and also using condoms, okay? The third thing that I wanted to say about this medication is that it contains vitamin A. So if you're on this medication, do not take this medication and vitamin A together, all right? And the 4th thing that NCLEX might ask you about this medication is one of the side effects is that it causes really, it is very irritating to the skin. It causes inflammation before it actually starts to be therapeutic. So what you'll have is inflammation of the lips, the mouth, everything will just be red and it'll look swollen and puffy. But we tell them that this is a normal side effect and they must continue to take their medication if they want to see results. So these are just some tips NCLEX might ask you. The psych priority of this age group is actually depression. Which is kind of sad, but this is what the research has showed. So suicide is one of the most prevalent causes of death in this age group. Let's move on to the next age group, the 19 to 40 age group. They have 2 major concerns, okay? So the first concern is to resolve issues that are still present from their adolescent state. And you see this in the early adulthood, self-esteem, acceptance. Remember, we're trying to establish our social relationships during this age group. The second concern is when this age group gets sick, they're very concerned about who is going to fulfill their responsibilities, who is going to manage their kids. How are they going to get time off of work? So when a patient is sick and as a nurse, these are issues that you should know they're going to come in with, which may be a barrier for them to learn about medications or learn about procedures. And that is what NCLEX is seeing if you know how to identify. Okay, very simple. The next age group, what is going on with this age group and what is the major priority is to identify diseases that are present very early on. And the best way you do that is by looking at risk factors, okay? Hypertension and hyperlipidemia are the most often diagnosed in the hospital when the patient is coming in for other things at this age group. So a patient will come in complaining of indigestion or they'll come in because they fell and broke their leg, and guess what? They find out they have hypertension. Their cholesterol's through the roof. They have diabetes. So these are often misdiagnosed because as busy adults, you just don't have time to make yourself a priority in this society. So as nurses, we want to be able to recognize these things early based on risk factors. Now, this brings me into the community health levels of prevention. This is a perfect segue into this information. So let's look at it. I always got these confused, so I want to make it very clear. Primary, secondary, tertiary interventions. On your paper, primary interventions, when you see primary interventions, I want you to think of the patient who is healthy and who you're trying to prevent from having any diseases, okay? That's primary prevention. So examples of primary prevention are screenings, immunizations. What else do I have here? Clean environments, making sure that the environment's clean, there's no pollution, they're not living in trashy areas, and also sanitation, good drinking water, okay? Perfect, you guys. All right, let's move on to secondary prevention. Secondary prevention is all about recognizing the disease early and treating it. So examples of secondary prevention methods are medications, okay? If you find out you have diabetes, we want to put you on insulin. Insulin is a secondary prevention, okay? Also, any kind of screenings. If you have breast cancer, we want to screen it. We want to stage it, okay? Prostate exams. These are screening methods. These are secondary prevention methods, okay? HIV testing is also a secondary prevention method. Now, tertiary prevention is all about, tertiary prevention. That is about containing the disease, okay, or containing the damage that will be done to your patient. So examples of tertiary prevention are physical therapy after a stroke. The stroke has already happened. There's nothing you can do. Let's do physical therapy. Let's do occupational therapy. Another example of tertiary prevention is dietary measures or dietary education. Say you have a patient who already has AIDS. What you want to teach them is what is going to give them the most nutritional benefit from the things that they consume. So I thought those were a good breakdown of primary, secondary, and tertiary. Now, the psychiatric concerns for this age group is when they get sick, or even when they're healthy, how they have to care for not only their children, but now it's time they start caring for their parents as well. So this is called the sandwich generation because they're stuck in between those two generations. Now, let's move on to our elderly, our 60 and up. The goals for this age group is to have them to maintain their physical abilities, to prevent cognitive decline, and possibly we would want them to be able to positively grieve the loss of a spouse or a job. There are 3 major nursing concerns when it comes to this group. The first one is medication safety, and that is in terms of adverse effects to medication. And you guys know that the elderly, they have a lower metabolism. They're not eating as much. They're not hungry. And also they have higher percentages of body fat and less muscle mass. So that is going to allow them to hold on to medications a lot longer than someone who was of a younger age. The second one is falls. Isn't falls precautions a huge deal in the hospital? Yes, because with the elderly, some may experience a mental decline. There are 3 things that you can do to help your patient to prevent falling. The first one has to do with communication. All right, be vigilant about call lights. Giving your patient call lights on NCLEX is great because what it allows them to do is press a button to have immediate assistance if they need to get up, to walk around. The second thing is address pain. When the elderly are in pain, it prevents them from thinking clearly sometimes, right? Just like yourself, when you're in pain, it's hard for you to do anything. You can't go to work, you can't go to school, you can't think, so you want to address pain. The third thing is prevention. What do they say? Prevention is worth more than the cure. So what we want to do for our elderly is we want to put them in non-skid socks. We want the bed to be in the lowest position. We want to have bowel and bladder programs in place. Bowel and bladder programs just mean that you are coming around every 2 hours or every hour to assist them to the restroom. The third major concern is going to be skin breakdown. And of course, skin breakdown is related to poor nutritional status, immobility, also restraints. If the elderly are in restraints, it's easy for them to have skin breakdown. So we have to be very vigilant about are we following the proper restraint protocol, and we will discuss that for NCLEX. And then using a standardized way to assess the patient's skin. That way for NCLEX is the Braden scale. The Braden scale. And if you guys don't know Braden scale, I want you to look it up and just take a quick look at the different categories and the numeric value related to each category. Okay? So we had medication safety, we had falls prevention, and we had skin breakdown. Now, what I like about the next page is that it gives you, it's a resource that I found, and it gives you pictures as well as the description of skin breakdown. So what I would like for you guys to do, if you want, is to make flashcards, because NCLEX could possibly give you a picture of a skin that's broken down and ask you to stage that breakdown. So it would behoove you to do that. This is the nursing care for wound prevention or wound care. So what we do, number one, we frequently change positions every 2 hours. 2, never give a hot bath or use hot water with a patient with a dermal pressure ulcer. 3, we use pillows for support, and the head of the bed should be raised at least 30 degrees. 4, we lift, we don't pull. 5, never massage over bony prominences. 6, give at least 2,000 milliliters of fluid a day. Welcome to your pregnancy lecture. The very first thing that you see at the top of that page is what? The HCG hormone. And this is responsible for keeping the pregnancy viable until the placenta is formed. Now, there are probable and there are positive signs of pregnancy. I did a YouTube video on this, but if you haven't seen it, let's just go over it. The probable signs of pregnancy are all blood and urine tests. Doesn't matter what it is, urine pregnancy test, home pregnancy test, blood test, they're all just probable because there are other factors that will allow the HCG hormone to develop. Say if your patient has a tumor in their uterus, the body might think that it's pregnant. The positive signs of pregnancy are the signs that allow you to definitely know that there is another human being growing in that woman. That would be a Doppler. That would be an ultrasound where you can hear a heartbeat, or an X-ray where you can see a fetal skeleton. Now, you have to know Nagel's rule in order to estimate the delivery date. NCLEX will give you the last menstrual period, and you have to give them the expected delivery date. So these are the rules. You want to add 7 days, subtract 3 months, and then add 1 year. So if NCLEX says that the last menstrual period was April 14th, 2000, when is that EDD? The estimated delivery date would be January 21st, 2001. That was a very simple, easy problem for you. Okay, doctor's visits, up to 28 weeks, you are going monthly. 28 to 36 weeks, you are going every 2 weeks. And then if you're above 36 weeks, you are going weekly, getting ready to have that baby. There were 2 definitions that I wanted you to know. I wanted you to know the difference between gravity and parity. Gravity and parity. Do you know what gravity means? Gravity is the number of pregnancies that a woman has had. So anytime that a woman has been pregnant, whether she's had an abortion or a miscarriage, that all goes into the gravity. So parity, on the other hand, is the number of pregnancies that have been carried to term or resulted in a live birth. Let's talk about the teaching for pregnancy really quickly. Pregnancy and morning sickness. What do we teach our patients? We teach our patients to eat dry carbohydrates. Usually morning sickness is a result of the blood sugar dropping. So you see it in the morning because during the night, the blood sugar tends to drop because you're not eating. So when you wake up in the morning and you're pregnant, you're very sick. So we teach our patients to eat saltine crackers, ginger ale, clear liquids. Those kind of things will help. Pregnancy, and the second one is backache. What do we say? Use good posture, wear low-heeled shoes, and do the pelvic rocking technique. For pregnancy and leg cramps, we tell our patients to take their big toe and point it to the ground. And what that does is that is going to stretch out the gastrocnemius muscle. So we tell them to point that big toe to the ground and then up to the ceiling. And that's plantar flexion and dorsiflexion of the leg. Now, the second one is diet. We know pregnant women need to take prenatal vitamins, which include a folic acid, which will help prevent neural tube defects. What is the neural tube defect that you guys learned a couple pages back? Do you remember? Spina bifida. Folic acid is very important to prevent things like that. So we know that the diet has to have a prenatal vitamin and also has to be high protein for the baby and the mom. Okay. Anemia. It is normal for pregnant women to be slightly anemic. Why? Because it takes extra red blood cells to help that baby develop. And where's the body going to get them from? They're going to take them from the mom. So it is normal for the pregnant women to be anemic. What you will see is the hemoglobin and the hematocrit will drop, but the plasma level will be elevated. And the last one is Kegel exercises. Kegel exercises are important because they help to prevent urinary incontinence, which some pregnant women might experience because as the uterus expands, it tends to put pressure on the bladder. Okay, let's talk about the danger signs of pregnancy. The first thing you would notice is sudden abdominal pain. The second thing is an abrupt flow of vaginal fluid. The third thing is vaginal bleeding. And the fourth thing is puffiness in the face and in the hands. Now, whenever a woman has vaginal bleeding, you guys know we never assess her vaginally. These are the danger signs that you look out for. There are two complications of pregnancy that I want to talk about. The first one is preterm labor. And preterm labor is any labor before the baby is ready to come out, right? So any labor before 37 weeks is considered preterm. There are two medications that we give to stop preterm labor. The first one is called terbutaline. And the thing you want to watch out for when you give a patient terbutaline is tachycardia in the mom and in the baby. The second medication is mag sulfate. Now, mag sulfate acts like a central nervous system depressant. So what you will see a decrease in is the mother will have a decrease in reflexes, a decrease in respirations, and a decrease in urinary output. So whenever you give magnesium sulfate, it would behoove you to think about initiating an indwelling catheter or a Foley bladder catheter to monitor that urine output. And what is the normal urine output that we should be getting from a woman every hour? Do you know? How many milliliters? 30, okay? The second complication that I wanted to talk about is actually preeclampsia. Do you guys know what preeclampsia means? Preeclampsia is the hypertensive state seen in pregnancy. Now, the three defining characteristics of preeclampsia are hypertension, edema, that puffiness in the face and in the hands. That's what you're going to start to see. Now, it's normal for pregnant women to have some swelling in the lower extremities, but when their face and in their hands start to get puffy, that makes you think that something could be going on. Okay, so we have hypertension, edema, and then also proteinuria, or protein in the urine. And there should never be protein in the urine. So this is a problem here. Now, what is the treatment? The treatment is bed rest and magnesium sulfate. Bed rest and magnesium sulfate. The only cure is to deliver the baby. There is no cure for preeclampsia. So we really need to get that baby out of there as healthy and as soon as possible. Now, let us look at the nursing care for preeclampsia. What do we want to do? We want to put these patients on bed rest because their blood pressure is so high. We don't want them walking around. We want to put them on bed rest. We put them in the left lateral position and we monitor their diet. What kind of diet should a patient with preeclampsia be on? Think about the problem. What's the problem with preeclampsia? The problem is their blood pressure is too high. So what's the appropriate diet for somebody whose blood pressure is too high? The low sodium diet. Low sodium fluid restrictions, okay? So we put them on that diet and we monitor them for eclampsia. We're monitoring them for eclampsia because right now they're preeclamptic. So what is the difference between preeclampsia and eclampsia? Do you know? With eclampsia, the patient is now